Hello everyone. This presentation is on Liu Junzai Tang, also called Six Gentlemen Decoction. It is on the California Acupuncture Board Herbal Formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Liu Junzai Tang belongs to the category Tonify Kai. A representative pattern is spleen Kai deficiency with phlegm damp causing nausea, fullness, and loose stool. Important ingredients include Ren Shen, Baizhu, Fu Ling, Gan Kao, Ban Zia, Chen Pai. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 62-year-old woman with chronic weak digestion and nausea. The current medicines are metformin, warfarin, omeprazole. This case gives a possible reason to consider Liu Junzai Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Ren Shen plus warfarin. The mechanism is that ginseng can alter warfarin effect in some patients. The clinical significance is potentially moderate. My management plan is increase INR monitoring at initiation and discontinuation. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Ren Shen plus metformin. The mechanism is that ginseng may add to blood sugar lowering. The clinical significance is moderate. My management plan is monitor glucose during use. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Banzia/Chen Pai plus oral medicines. The mechanism is that changes in GI motility and tolerance may affect how medicines are absorbed or tolerated. The clinical significance is usually low. My management plan is separate dosing if medication-related stomach upset occurs. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Liu Junzai Tang may be reasonable when the patient truly matches the pattern spleen Kai deficiency with phlegm damp causing nausea, fullness, and loose stool. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.